Hello, Tim.
Hi, Ollie. We're back together.
We're back together. It's been a while, isn't it? It's really nice just to be having a one-to-one conversation. I really look forward to it.
So today we're going to think a little bit about how health coaching, I suppose, has maybe re-energized our careers, I suppose, as in our general practice, but also maybe more widely than that. So I don't know if
Yeah.
you want to kind of lead off, Ollie, and just kind of share a little bit about maybe your journey and how it's been and what difference that's made to you.
Yeah, sure. It's interesting, isn't it? It came out of it's what happens when you go on holidays and you come back all refreshed and you say, well, you get back into it and why you review why you're doing this and what the kind of the sort of driving purpose of what you're doing is, I think. And it led us to this, didn't it? We acknowledged that actually one of the main reasons we find health coaching so alluring and so interesting and why we, are drawn to practice this way and teach it is that it's been so impactful for us personally, isn't it? And I absolutely, as you say, I feel it has kind of really recharged my career, I think. Not that I wasn't enjoying myself or finding medicine highly satisfying, but I suppose that I've always had that fundamental belief that healthcare is built around the person, and that as a healthcare professional, the part you play is as an enabler and as a supporter. And for me, health coaching gave me those tools to be able to do that professionally and skillfully. So it really resonated with you know, my core beliefs. I think about how healthcare should be practiced, and undoubtedly, learning health coaching has helped me to sort of navigate my workplace better. How about you, Tim? What's your experience of it?
Yeah, it was interesting to hear you say that because I'm not sure whether I started from that same place. I kind of thought that when I was working as a GP, and I wish I loved working as a GP, I kind of thought that the coaching was just another nice way where I can kind of maybe give some people some advice, but maybe in a way that they would take it. Do you know what I mean? So I don't know that I was thinking about, oh, this is much more collaborative. But I absolutely remember a time, and it's quite early on because I started work as a GP in probably 2000, 2001. And then it was about 2008. I start to lose a little bit of momentum. I'd
Mm.
worked at the pain clinic over that time as well, and I think I was just starting to kind of get myself in a bit of a rut with people not seemingly kind of getting much better, and maybe just kind of feeling like my general practice had kind of got into a bit of a rut as well. And then I had that penny drop moment at the pain clinic, which was that the people who seemed to do well were those who realized they had a contribution to make. And I knew then that my job was much more about tapping into that internal resource that people have to look after themselves, which is a coaching mindset. I didn't realize it at the time. And really early on, I did an NLP course and I got very evangelical about neuro-linguistic programming.
Yeah.
And I thought, this is it. This is it. I found this
Well,
is
you'd
the
been on
holy
a
grail.
course and that was it. The course, this is the latest course. This is what we have to do. Yeah.
Yeah, well, I did a practitioner course and then I went even deeper and did a master practitioner course. And I managed to kind of, I think at the end, pull myself back to kind of reality. It was really good training and I would recommend it to folks. Um, but I kind of thought, this, and I found a useful way to work with people, which energized my consultations with the NLP. And then quite a lot further along, I then came across coaching. And I thought, oh, this is what I've been trying to do over all these years. And then when I had a framework that I could work in, I could do it a little bit more deliberately, skillfully, and yeah, more consciously. And
Yeah.
yeah, so that's how I found my way into coaching. But I found it probably was via NLP that started to light that fire that actually we could do things a bit differently. What about you?
Yeah, yeah. Well, I think it was yes, it was through working the pain clinic with you actually, and it's that slightly uncomfortable moment, isn't it, when you realise it's not all about you, isn't it? I mean, I know, you do your A levels, you get great results, you go to medical school, mummy and daddy all think you're wonderful, and they're telling all their friends at home and everything, and you think you're the hero of the world, don't you? Going out to save everybody. And then, actually reality hits and you realize, well, actually, it's not really about me. It's about what the patient does. I remember in one of Chris Ham's paper, he wrote a great paper for the King's Fund called Shared Responsibility. I think it was back in 2018. And one of his quotes in it, I was having to look back at it actually. I think he quotes Sobel when he says that the patient is the most important primary care provider. So you read that as a GP thinking that, hang around, I thought I was the most important primary care provider. I've got nurses to support me. I've got receptionists to make appointments for me, but actually turns out I'm not the most important person, it's the patient. So there's a little bit of a okay, but actually why it recharged my career is because it just takes so much responsibility off your shoulders, doesn't it? You realize, oh, okay, so my job is to make you as good as you can be. It's not for me to solve all the problems or for to be the rescuer or the one that comes up with all the best ideas. It's for me to enable you to do that. And I think that shift in dynamic was undoubtedly the turning point in my career, where I kind of felt this weight come off my shoulders. Not because I just pushing it back to patients and go, oh, it's all on to you now. It's personal responsibility. It's all up to you. It was this sense that like I could learn skills that enabled us to share responsibility, and that was definitely a turning point in my career.
Yeah, well, that's so interesting. It kind of resonates with me. And I remember sharing this story with folks before that, I have three children, and I was talking to my wife about one of the other children. And my eldest piped up and he said, Dad, but what about me? I said, life's not all about you. He said, well, it should be. And I kind of feel we have that, don't we, with health and social care professionals? We have that kind of, it is all about us.
Yeah,
And I even remember in GP school, we learn about ideas, concerns, expectations,
yeah,
ICE.
nice,
We
nice. Yeah,
have to do that. So, but we're asking about the ideas the patient has about what's causing their problem, what concerns they've got about it, and what they expect us or what they hope for us to do about it. But when it gets to the kind of the diagnosis and the treatment plan, it's all on us. It
yeah,
felt like it's all on us. That's our job. And yes, we might share the treatment plan and we might try and, share it so we have some shared decision making about the next steps. But really, it was all about us.
yeah, yeah.
So, like you, when I had that kind of light bulb moment that it's not all about me, one, again, that kind of responsibility lifting off your shoulders, but also having those few experiences early on where you ask someone, what do you think?
Mm,
What do you think would be really good? And then people would say, well, I think we could do this and this and this. And I'd be like, oh my goodness, I could never necessarily come up with that.
yeah,
What
yeah,
a brilliant solution. And think, well, actually, the more experience you have of that, when you ask someone, what do you think might work here for you? What's your experience? What's worked well for you in the past? Just tap into that before you then start launching in with, what you think we should do. So
yes. And did it
that,
always? I mean, did you sometimes find patients would go, "Oh God, I just want you to give me an answer and sort me out," and that they were a bit unsure of this? When you suddenly shifted your approach, Tim, did some patients push back?
yeah, and I think that's to be expected, isn't it? That people will say, well, you're the doctor, you tell me. And we have trained our population to respond to us in that way. That we've
Yeah,
set the whole system up so that we're the experts and people come to us for the answers. So I think one is to expect that, and probably my response was, well, actually, I have got some ideas. It's not like I don't have any ideas here, but what I know is that you're the expert in your own life, and you'll probably have some really great ideas as well. So I'd love to hear yours first. And
yeah,
people just need that encouragement, right? Because actually, whilst we come up with all the solutions, one, it weighs heavily on us, but two, people then don't get the courage to think for themselves, which I think is one of the beauties of health coaching skills, is you encourage people to think as far as they can, as far as they are able, for themselves. All right.
yeah,
So it's not
absolutely.
saying it's all up to you, you must do all the thinking, but you want people to be encouraged to think as far as they can. So then next time something happens, they think about it first and then maybe come to see us
Yeah.
after if they need to.
Absolutely. And I don't know about you. I don't know if this resonates for you, but I remember when I first started coaching, it's a bit like riding a bicycle, isn't it? When you take your stabilizers off and you're sort of like wobbling and you think, am I going to do it? Am I going to do it? When you ask patients, have you got any ideas or what do you think or where do you think we should take it? And you think they're going to throw it back at you and go, it's your fault or, your job, and you're going to jump back in again quickly and sort of like, stabilize it. But actually, when patients do start to come up with ideas, you suddenly start thinking, oh wow, that's really cool. I wouldn't have thought of that. And you get on a roll, and it's a bit like that feeling of suddenly you've got your balance on a bike, and you just feel more confident, don't you? Sort of stepping back and go, okay, now I'm going to give space for you to come up with your ideas. Might be tricky, might be hard at first. You might take a little while to get it, but if you've got that confidence that if you do give people enough space, nearly always they will come up with something really good that resonates for them. It just allows you to feel confident in the approach, doesn't it?
Yeah, absolutely. And I think sometimes we do get a bit of pushback, I think, sometimes on the courses from healthcare professionals because they're already time poor.
Sure.
They haven't got loads of time to do extra kind of coaching stuff.
Yeah, yeah.
And so from my viewpoint, there's a whole lot of stuff that we can stop doing that will maybe create a bit of space and a bit of time for to ask these other kind of maybe more encouraging questions that get people thinking.
Well,
And
go on
one
then.
of
What would you stop doing then? What would you
well,
stop?
I'd stop giving people advice
Hmm.
that they don't want and don't need, probably. I'd stop giving people advice because advice is directive. It stops people thinking. People might need information. They might need really good quality information, of course, in order to think really well. But that information needs to be given in a way that they can absorb it. And lots of people who come to us in general practice are overwhelmed.
Yeah,
So actually, you giving them some advice is a bit of a waste of time because they're not in a position to absorb it. So my conversations changed to be something along the lines of, what information is going to be useful for you here?
yeah, yeah,
Rather than launching into the patter. Sometimes you just get into a patter. Oh, well, I'm going to prescribe a cholesterol medication, so I'll just get into my patter if this is how I do it. It's actually, one of the things that we could do here is to start some medication. What information would you need to know that would help you decide about that?
yeah, yeah.
Because actually, side effects may not be of interest to people. They
Yes.
might want to know, well, how effective it's going to be. How long do I need to take it? There might be a few things that might be really important for them. It doesn't mean we don't mention side effects, but it means that we don't waste a whole lot of time going through all of that when the thing they're most interested in is how often do I need to take it? How much of a burden it's going to be. Do you know what I mean? It's just
Yeah,
tapping into
totally. So
what people
you,
already know.
I think we've learned, and when you can be confident that taking this approach is actually time saving in the end, and it is more person centered. And in the end, if people usually given the space, they really enjoy it and appreciate it. So it sort of I mean, we were talking, weren't we, about how it had reinvigorated our careers, but also I think coaching is a protector for burnout. There's so much talk now, isn't there, around people burning out, sort of like getting exhausted, getting skeptical, and with that losing their efficacy as a doctor. Or any healthcare professional, as a nurse, a OT, a physio. We know when we burn out, we become less effective. And there's something for me about burnout being around you, sort of like not being able to keep up with what your expectations of yourself, sort of almost losing control and just like drowning. And I think that's what learning to health coach helped me to do, was to learn what I can and can't do, what I should and shouldn't do in different situations. As you say, letting a whole lot of stuff go, but also feeling comfortable that allowing time and space for the patient and encouraging the patient would in the end be much more productive and much more sort of positive for both of us. So it just sort of releases you to feel more comfortable in how you practice, I think. And I think it's definitely protected me from burnout. And I've heard lots of other people say that. I was talking to a public health doctor just recently who said that when he was burnt out, having coaching really helped him, but also then learning to practice as a coach in his career moving forward. So often that happens, isn't it? People have coaching and they go, "Oh, this is great. I'm going to practice like this now," and that really helped him in his career.
Yeah, exactly. Uh, yeah, yeah. Is there anything more in terms of for you that's kind of made a difference, would you say?
Well, I suppose I'll come back to that shared responsibility thing, really. I think, and I think about that, the Eric Byrne thing, the kind of the Cartman, no, sorry, the Cartman thing, isn't it? Cartman drama triangle. And with that, the Eric Byrne's the adult to adult sort of thing, isn't it?
Mm.
That we tend to take one of those three roles, don't we? We're either the persecutor, or very commonly we're the rescuer as a healthcare professional, and sometimes we're the victim because we feel like the patient's kind of like blaming us for not getting any further. And that that drama triangle is not a healthy place to be. It's not healthy for the patient. It's not healthy for us. And so, that so often we recognize, don't we, as healthcare professionals, we are the rescuer. We take that rescuer role, and it's not very healthy for anybody. But I heard recently about is it David Emerald's alternative? Have you come across this?
No, no,
The
no.
the TED model, the empowerment dynamic. He says so. Instead of being a victim, you become a creator, and you think of the ability to create things and to think creatively, whether you're a professional or a patient, is a kind of real sign of health. real sign of a sort of productive sort of position to be in. And then, to enable people to create, so you have a challenging role, which is a sort of growth mindset where you're supportive of people, but you're challenging them to grow and to sort of like enhance their approach in a positive framework. And then the other part of it, the sort of empowerment dynamic, is that of a coach, which it is that you really believe in people, and it's almost like the antidote to a rescuer. Instead of being a rescuer, you're a coach, and as we know, learning the skills to be a coach, it enables you to take that role.
Yeah. I'm just thinking back to so one of the some of the things that we might then have to give up, I suppose, if we're going to work in this way, is
Yeah,
being the hero, is being the rescuer, is being
yeah.
that kind of the person that solves the problems.
How have you
Um,
found that, Tim? You're no longer the hero or the rescuer.
I know. I remember one. I'll tell you this story. So I remember working with someone about their kind of issue with their sleep, and spending quite a long time, and and they came back and I said, well, how's your sleep going? And they said, oh yeah, I've slept really, really well. And I was starting to kind of think, oh yeah, I feel really, really good about that. And he goes, yeah, I got myself a new mattress, and it's been so much better since then. And I'm thinking, oh, so even though you might work, I was like, it's not the mattress, it's all the work I did
Yeah.
behind the scenes. But you know, that's one of the things you have to let go of is actually, and the greatest joy is when people are able to take the credit for their own successes. That's what we want, really.
Yeah, it's brilliant.
Um,
There was a famous, I think it was one of the American presidents, wasn't it? It said, "You can achieve anything as long as you don't want to take credit for it." There's something, isn't there? And there's maybe something in all of us as healthcare professionals that we want to feel like we've done a good job and that we're often people pleasers, aren't we? So there's something about coming to terms with that. But I think the positives of seeing people flourish in your presence, really, through under their own steam. It's so lovely, isn't it? It's lovely to see someone benefit of your fantastic advice and the support you've given them. But actually, I'd suggest it's even nicer to see them flourish under their own steam and know that you've played a part to sort of light a bit of a fire or create a context where they can really find their own, get their mojo back. And ultimately, I've found that so much more satisfying. Those moments when you sort of punch the air. Have you ever had those when a patient's left the room and you sort of think, yes? And I used to have that when I thought, yes, that my drug worked or they've taken my advice and that plan worked out. But much more I find I get it now and I just think they're flying again. They're shining, and it's just you pick up that energy off people and it's a much better yes, I think.
yeah, and I suppose people really also, you don't think they necessarily will, but they really appreciate the opportunity and the space to think for themselves. You think they might not want to, and maybe they might need coaxing and encouraging to start with, but actually, people do sometimes come back to them and they say, "Oh, thanks for listening," or thanks for doing something." You think, actually, I didn't do anything, but actually, of course, what you've done is provide that space for people to think things through for themselves, come
Yeah.
to their own conclusions. But sometimes you still get the credit for that, which is also nice.
Yeah, he's
Um,
good. Yeah, you can reflect, bask in that reflected glory, can't you? But I also think the other thing that's made me think is that, and we've noticed this a lot, haven't we? Is that in learning to be a coach, it's actually a tremendous boost to you as a person as well. And where I've seen that really play out is two factors really. One is expert patience that I've seen go from, if you like, the kind of victim mode, perhaps always receiving care, to starting to take a role, initially looking after themselves, but then often they'll develop into the coaching role and they'll offer peer support and sometimes even train up as a health coach. And I love that progression because I think bringing lived experience into health coaching is really powerful in itself. But you also see that in learning those skills and taking on that coaching role, they really grow as a person. So it's a tremendous, it's sort of like progressive journey for people to go on as a patient. But also, I think in workplaces, I've seen people who perhaps might be burnt out in their workplace, not non-medical people who learn coaching skills, perhaps, health coaching through us, but coaching skills in general. It enables them to give back something to the system that they couldn't do before. Releases them from some lots of pressures, as we've said, but it can really help people to recharge their careers. So it's just the process of learning to coach and having those skills up your sleeve. I think it's just highly enabling across the board.
yeah, I agree. I think we ask some of this now, don't we, on our feedback questionnaires, and I think There's a recent result I was just looking at that 75% of this group that we work with who are kind of working in rehab after stroke, and 75% of them, just on the kind of our 2 day program, they said they felt their work was more meaningful. And I think that's one of the things that people sometimes over the years, they sometimes get a little bit disconnected from the reason why they got into the job in the first place,
Yeah, yeah,
and feel like they're just kind of almost going through the motions, maybe not really making a difference. But
yeah,
actually learning some of these skills, being able to kind of interact with people in a different way, helps reconnect people with why they got into it in the first place. Which I think,
yeah,
if I think back to my, why I wanted to do medicine, it wasn't probably that, as you were saying, it wasn't to be the hero. It was to make a contribution and to support other people. And I think
yeah.
that's what coaching allows, or has allowed me to do, I suppose.
Yeah, I think that that's so crucial. I love you shine the light on that, asking people how meaningful their work is. I know you know I love that, and in fact we do that in our network. Actually, we we ask people how meaningful is your work and how manageable is your work. And one of my heroes, we'll call him a hero. You know, sort of he probably wouldn't want to be a hero because he's a coach as well. Professor Michael West, who's a Sheffielder, done so much research around what it is that leads to good quality outcomes in healthcare and staff empowerment, whether they feel they're able to do meaningful and manageable work. Those are my words, whether they're able to contribute and be a part of it, is the single most important contributor to quality of care across the board. So, paying attention to how meaningful your work is. It's not just a nice to have, it's not just a sort of scented candle, tree hugging thing. It's actually a real hard marker of good quality care. So, if you feel your work is more meaningful because you've adopted some new skills, fantastic. It means that you're going to be part of a better system.
Yeah, I absolutely agree, and I think there's another bit that I kind of just to bring in about that kind of effectiveness and efficiency, and I think we're very driven, aren't we, in the NHS about being efficient, which means like getting through the numbers, being as quick as possible,
Yeah, yeah,
and actually it's probably not as effective as it could be.
yeah.
So, and I think health coaching allows us to be probably our most effective, um, and time saving down the line. So yes, efficiency, maybe in the long run. And I know sometimes we're very kind of short-sighted in healthcare. We want to kind of get results straight away, but actually effective healthcare, I think, is about providing space for people to start to think about their own health for themselves. And when
Completely.
they do, they don't need us. And wouldn't that be good?
Well, it is. I mean, it's sort of. I know we're puppy dogs. We're always positive, aren't we? But like, it genuinely is a win-win, isn't it? That's what's made me so enthusiastic about health coaching and coaching in general. It's a real win-win, isn't it? Because as we've said, it feels better to you, takes the pressure off you, stops burnout, recharges your career. But whilst doing that, perhaps quite selfishly, maybe you're actually delivering care that is highly effective for the system and for the patient. Because we know that if you're focused on building a patient's agency and autonomy, actually they do better. So it's just like, in practicing in a way that looks after you, you're also practicing in a way that's going to be more effective. So it's just so compelling, isn't it?
Yeah. Yeah, yeah, yeah. It's difficult to think. Why wouldn't people do this, Ollie? Why wouldn't they do it?
Yeah,
And I can see how people can kind of get kind of locked in or get into a bit of a rut in terms of where they are with their work. And goodness me, the pressures are huge, aren't they, on colleagues at the moment? But
maybe it
actually,
is.
yeah.
Sorry, go on. No,
Well,
you
I
could.
was going to say, actually, we're not asking people to kind of stop doing a whole lot of stuff. It's more to do this work alongside and within the work that you're already doing that's working well. So we absolutely appreciate, for people, you can't do this as well as everything else, but
Exactly.
this allows you to work in a different way where you can stop doing some stuff and do some things which are more effective, which actually then makes your work more meaningful.
Yeah, that's exactly what I was going to call back to what you said earlier on. Actually, there's a leap of faith in this, I think, isn't there? Which I think both of us have been through and seen through the other side. Is that you do have to feel comfortable not doing some things, making space for the patient, stepping back, but also, you know, you've only got so much time, haven't you? If you've got 10 minutes with someone, you could speak really quickly and try and rush through stuff and do a whole lot of stuff quicker and quicker and quicker and squeeze more in. But I think generally that doesn't really work very well. You end up everybody getting stressed out. So you've got to decide, what am I going to do here and what am I going to do really well and with the right time and the right pace. in the time that I've got, and value that and think, well, I spent my 10 minutes asking that patient about what's most important to them and finding out where they're at and just maybe getting to think about a few ideas and, shining a light on some of the things they might not have recognized they're doing well, and sent them off feeling a bit more positive about themselves and starting to think that maybe they can do some things they didn't think they could do before. You think, well, you didn't prescribe a medication, you didn't refer them to a specialist, sort of, but actually maybe you've done something that has really shifted their trajectory. So it's something about having confidence that when you choose to apply some health coaching or you choose to work in that way, that's the right thing. I don't know. The only last thing is, I guess, the anxiety if you're a medical doctor, you've got this job, haven't you, to pick up on things you mustn't miss. Do you know what I mean? You mustn't miss cancer or infection. There's all those sort of like, there's that job, isn't there, to make sure we're not missing serious stuff. So I suppose there's always that sort of underlying pressure to some degree, isn't there?
Yeah, we must. That is maybe, yeah, that is our main role, is making sure that we're safe and our patients are safe. And so we definitely have a role there. Um, but that shouldn't be, I think, all that we do.
Yeah.
If that's all that we do, I think we're gonna burn out really quickly because we make it all about us
Yes.
doing that. And we know what a joy it is when people start to step up and start to think and look after themselves. So we need to make space for that. I know there's this quote that kind of people with long-term conditions use about 4 hours of healthcare professional time in a year. That leaves 8,756 hours when they are self-managing.
Mm.
So if we're not doing anything in our 4 hours, which helps them for the other 8,000 odd, then we're missing a trick. So
You've
I
been
think,
talking to Pete Moore again, haven't you?
well, I have, in fact, I have just spoken to Pete Moore, but I do remember. So Pete Moore, who wrote the Pain Toolkit, excellent resource, by the way, for anyone
Yeah.
who's living with pain.
The
Um,
self-management guru, isn't he?
exactly, exactly. But it's so important, isn't it, that if we don't do anything in that time that we've got, then we're absolutely missing a trick because people do sometimes listen to us. So actually, if we can do some stuff which gets them to think for themselves in those 4 hours, I think we've done a good job.
Also, you're literally making time. If your 4 hours then spreads out to great self-management across the other 8,000, whatever it is, you've actually created an incredible. It's like a catalyst, isn't it? Coaching is a catalyst, really.
Yeah. Well, again, as you've said, you can have people who start to think for themselves, they start to look after themselves, then they become a resource for other people. And that's the thing that makes kind of healthcare sustainable is actually when it's held in and it comes from the community. That's the thing that makes it sustainable, not us doing more or having more doctors, although I know we need more doctors right now, but it's not about us doing more.
Absolutely. Yeah. Lovely. Oh, it was a great conversation. So I'll do my final summary and then let you say your last piece as well. So I think in summary, we've learned over our career that coaching it's a great enabler and recharger for us as a coach. And we've seen that as people learn to coach and learn the skills behind it, it really recharges their career. But it's also a win-win because in working that way and creating space for people to have their own ideas as patients or colleagues or whoever it is you're coaching, that actually they tend to do better anyway as well. So you can take that leap of faith, but have confidence that working this way is actually going to be good for everybody in the end.
Yeah. And I'm not going to say anything more, Ollie, but I will just absolutely echo your last thoughts. But it's been delightful to spend time with you.
And you, lovely. Well, please do, follow us on YouTube, subscribe. I think that's the thing you're supposed to say, isn't it? And coming soon, I think we might even take this podcast onto the kind of usual Spotify, Apple channels. Have we got enough confidence, Tim? Are we at that point where we think we might
Well,
go for it properly?
we've warmed up, haven't we? We've warmed
We're
up.
we're still
So
warming up.
I've warmed up to the idea of it, so we'll see. We'll see. See how
Yeah,
many
well, you
likes
you
we get
you
on.
warmed me up a long time ago, Tim. So just I'll have to nudge you a bit more. But it's always lovely chatting to you. Thanks.
Okay, see you.